Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. What I want to talk to you guys about today is about whitening, because I had a question from a student a couple weeks ago. And when you start working in an office, you have so many questions, so many things to think about. But one question that a lot of the patients ask is, so I was wondering about whitening. And then you're probably thinking, oh shoot, like this isn't something they teach you in school. This isn't in the textbooks. What do I tell my patients, right? The first thing you should ask the office is, what type of whitening do they offer? Because some offices offer the take-home option, and some offices also offer the in-office option too. Or some offices only offer the take-home option, and some only offer the in-office option. And the prices are different everywhere. Like I've been in an office, the same city, where the in-office option is $300. And another office in the same city, it's $600. I have seen where they offer the take-home option included with the in-office option for a certain price. So always ask that first. That should be one of the things you should ask the new office where you are is, can you just let me know what whitening system you use and how to use it? Because they're also all different. Ask what company also. I've only worked with a few whitening options, but so I'll explain a little bit about them to you first so you have the overall kind of idea. So the take-home option, which is just something that I personally prefer, is where you take impressions, or the assistant takes impressions of the patient's top arch and their lower arch also, alginates. You would send that to the lab to make the whitening trays, or sometimes they make the whitening trays in that office too. So it depends on the type of lab you have. So also ask that. Because if you're sending it to the lab, let the patient know that it might be about 2 or 3 weeks before you book the next appointment. Or even if you do it in the office, sometimes it can take 2 or 3 weeks also, because if it's only, say, the one assistant who knows how to make the whitening trays, it might take her 3 weeks or so to make them. So keep that in mind. But that's the take-home option. So then when the patient comes back, you will give them their impression trays. And typically, whitening solution comes in a syringe. Now, it could be 10% whitening solution, it could be 16%, it could be 20%, it could be higher. Every office is different. The one office where I worked in, we had the 10% and the 16% and the 22%. So 10% obviously isn't as strong as the 16%, but the higher percentage likely means that the teeth could become more sensitive. So depending on the patient's shade though too, like if the patient has like yellow teeth, and they're telling you, I would like these to whiten as quick as possible, then you might consider to give them the 16% first. But I like to start the patients off at 10% because it's the lowest, which means it will make the patients less sensitive, if that makes sense. But if the patient's saying to you, well, I kind of have to lighten my teeth in 3 days, they're yellow, then you might consider the 16% or even the 22%. But that's not usually up to you, actually. It's up to the dentist in the office, so maybe ask them. But there's also some offices that say you just do whatever you want, so you never know. I've had it both ways. But that's just what I like to do. But I do also listen to the patient too. Like if the patient has sensitive teeth now, I will start them off with the 10% so their teeth don't become even more sensitive and painful, because 22%, I wouldn't even use that. It would make my teeth so sensitive. I have tried the 16% before and my teeth were sensitive to the point where I haven't whitened since. because they were just so sensitive. But some people don't have any issues at all. So another thing that I like to mention to patients is before you I should say, before they start to whiten, tell them to use Sensodyne toothpaste every day, twice a day, even 3 times a day if they can, for at least 2 weeks before they start to whiten, because that will actually help their teeth be less sensitive. Their teeth may not be sensitive at all, but you never know. So it makes sense to use a toothpaste first to hopefully make the teeth less sensitive, right? I tell them to use it 2 weeks before they start to whiten. I tell them to use it also to continue it until afterwards also, because the teeth can be sensitive. I have seen it where people have started to whiten and they come in and they're like, my teeth are so sensitive. That's horrible. That's awful, right? So tell them to use the Sensodyne first. It can't hurt, right? It can't hurt. It's a simple toothpaste. But I will also say to them, so for the take-home option, they should whiten every single day. But if the teeth are super sensitive, do it every other day. If the teeth are so sensitive where they're thinking, I can't even do it every other day, then they need to come in for an appointment, because maybe they're not doing it properly. You know, who knows, right? But I've never had a problem with a patient who has used Sensodyne first for at least 2 weeks. So that's why I will always say, use Sensodyne first for 2 weeks, because if you don't, there's a good chance your teeth will be sensitive. Not 100%, but that's not something you want to risk, because it's your teeth. So if they're sensitive, it's going to be hard to eat. It's going to be hard to talk. It's going to be hard to have your coffee. So it makes sense, right, to just use the Sensodyne first. But this is where it gets a little bit hard. So depending on the company, I tell the patient to have the whitening trays in for at least a half an hour, but up to 2 hours. So it depends on the company, because some of them say they have to be in for 2 hours to work. Some say they have to be in for a half an hour to work. You know, every company is different because it depends on the solutions that's inside. So typically it's a carbamide peroxide and hydrogen peroxide mix, typically. But it depends on how much carbamide peroxide is in there. So they may only have to leave it in for half an hour, but you will always have those patients that say to you, well, I left it in for 4 hours just in case. Well, okay, they can, but usually if there's a carbamide peroxide and the hydrogen peroxide mixed, that mix becomes deactivated after 2 hours. So them leaving it in there for 4 hours would be annoying if you think about it. And it's not helping because it is deactivated after 2 hours. But every company is different. So if I don't know too much about the company, then I actually tell patients, leave it in for at least 1 hour, up to 2 hours if you're able to handle it. You know, because some say my teeth are just so sensitive that if I leave it in for 2 hours, ouch. Or they say, well, I have other things to do, so I can't just leave it in for 2 hours. You know, it depends on the person. But another thing that I say also is don't leave them in overnight. Some companies say you are okay to do that, but if you think about it, if you're sleeping, that hydrogen peroxide and the carbamide peroxide's in your mouth, you're sleeping, so you're probably swallowing it. How is that healthy? I don't think it is. It's up to you. It'd be easier to wear it at night because you're not thinking about it perhaps, but I prefer to not swallow that stuff. So does that make sense? So I tell patients don't do it at nighttime, or I tell them do not sleep with it in. What I like to do when I used to whiten was I would usually, you know, eat supper first. I would brush and floss, and then I would put them in for up to 2 hours. Because at nighttime, you're not, typically seeing a lot of people. You don't have to worry about somebody coming over. You don't have to worry about answering the phone, So I usually do it at nighttime. But then I've heard some people say that they prefer to eat in the morning, brush and floss, and then put the whitening trays in the morning. So if you're home, then hey, why not? So it just depends what's the easiest for you, but that's what I did. And typically, again, it depends on the solution, but you usually have to tell the patient that they'll be doing it every day for at least a week, up to 2 weeks. And then they should have the shade that they want, depending on the office too. I worked in an office where we would see the patient a week after. We had given them their whitening trays to make sure they're doing it properly, to make sure that their shade is actually becoming lighter. We would always take their shade at the first appointment and then take their shade a week later and then take the shade 2 weeks later, because a lot of them say to you, it's not helping, I'm not happy. But then if you show them the shade they had started with, and then the shade afterwards, they go, oh, wow, I had no idea. It's because they see themselves, right? Like they see themselves every single day, so they don't necessarily see that, yes, there is a difference. So we do that too. And they don't have to keep the solution in the fridge. They don't have to. Depending on the company, though, some are different perhaps. And typically, the whitening solution expires after 2 years. So that's a long time. And they don't need a lot. Again, it depends on the product, but let me show you. I have a pen here. So I will actually show patients how to use it first, because if you don't show them, they tend to use too much, and then it will be like all over the place. And then that can hurt, right? Because it should only be on your teeth, not like up here. Ouch, right? Because that's hydrogen peroxide and carbon monoxide. That shouldn't be anywhere up here. But if they use too much, they put it in their trays and then it's like everywhere. Ouch, right? So they only need like this little bit. I don't know if everybody can see that. Probably not. Like that's a half, like a size of a pea, half that, and then half that. They don't need a lot of solution. So show them how much they need, because if you don't show them, they always add too much. They'll be coming in 3 days later saying, I don't have any solution left. And you'll say, well, I had given you 5 syringes. Half a syringe should be good for 3 days. So how did you go? Like how did you use up 5 in 3 days? It does happen, right? And then they say, well, you didn't show me how to use it, so I'm not paying for more syringes. And then you say, oh shoot, well now people aren't going to be too happy with me because the patient's not happy, so they need more, but oh my God, they should really have to pay for that, right? Because typically, I know for us, for the whitening, we give them 5 syringes, and we tell them that that should last about a week, maybe even 2 weeks. It depends, right? But if they want more, then they can obviously order more. But they usually don't have to whiten like every couple months. It's usually every 8 months to a year, depending on the patient. Like if they smoke a pack a day, they will probably have to whiten about every 5 months or so, right? There are some people out there who will want to whiten like every 3 months. In my opinion, that's too much. But it's just my opinion. So I'm not saying that it's too much, but if you think about it, that's just too much. So I tell patients usually it's every 8 months to a year you will have to whiten, because this stuff actually works and it will help you. So that's the take-home option. That's the option that I actually like, because I feel that the patients can whiten slowly over time, so there's less of a chance for their teeth to be super duper sensitive. I have done whitening in office, but it usually takes about 2 hours, and their shade is about 3 to 4 shades lighter. That sounds amazing, but their teeth are always sensitive afterwards. Every single patient that I've seen that has done the in-office whitening, they have very sensitive teeth afterwards, and they have to stay open like this for like 2 hours, because usually we do the top arch first. You put on the whitening solution, you know, 3 or 4 different times, depending on the product. But the solution is like a 35 or 40%, because that's how their teeth get so light so fast. But I wouldn't want to do that, to be honest. Ouch, it sounds painful to me. It's not painful, but a lot of patients are very, very sensitive afterwards. So I say, if you have the time, do the take-home option, because you can lighten over time, which is more normal, and your teeth aren't as sensitive. So that's just what I like to offer, but every office is different. So please check what your office has, because I do know some that will only do the in-office, and some will only do the take-home. So you just never know, right? So just ask. So, okay, I think I explained everything. Did I mention that before the patient whitens at home, I do say to tell them to use the toothbrush and to floss first, so then that way the teeth are as clean as possible. And to use the Sensodyne, that's such a good idea, 2 weeks before. But those are just kind of the main things. So I do hope that helped. If I left something out, or you're not sure about something, just let me know. And I will see you guys in the next video.